Welcome in, folks. It is good to see you guys. I am so glad that you are here. I am Coach Ken, and right next to me is beautiful Dr. G.
Hi, guys. How are y'all?
There is nothing in the world that I love to do more than getting a chance to get on here and talk a little bit about our lives and to hear the incredible stories of so many people that have gone through life changes. I feel like I am this incredible master of ceremonies that just gets this opportunity to hang out with incredible people. And if you are coming into this room, if you have invited somebody, maybe you are interested in your metabolic health, you are got some questions, maybe you've seen us before, maybe this is your first time hearing about it, but you're going to hear a lot of great information from an incredible doctor. I can't say that I'm particularly all that incredible, but she is. But the thing that I want to start with is this, I get to come on here and kind of be that master of ceremonies and simply have the chance to say, look, I reversed my type 2 diabetes. I used to be a diabetic. I used to have hypertension. Those of y'all that have known me, I had allergies to all kinds of different foods. It was crazy, the things that I was allergic to. Migraines, acid reflux. I'm a cancer survivor. And all the things, I felt like my body was just coming apart all the time. And it's not anymore. At 54, I feel more like I'm 24. I actually went from wearing size extra large and a size 34, almost 36 pair of jeans back down to wearing size 30 like I wore when I was 24 years old. I mean, that's the transformation that dealing with metabolic health, with learning the skills that we're going to teach tonight and the tools that will make that possible is going to blow it away. Dr. G, you've got your own journey, your own story that's pretty dang incredible. I got to be first right on the front row of that.
Yeah, I do. I was on high blood pressure medication for 15 years and I was diagnosed in 2024, January, actually, a year ago, this month with prediabetes. They wanted to put me on a statin way back then. And I said, no, I could handle it. And then before you know it, here's where I was at. And had been diagnosed with fibromyalgia. I had thyroid cancer. So I had my thyroid removed. So I was a mess. I was a metabolic mess. That's what you could call that. And in about 3 months, I was able to reverse my prediabetes. I no longer have diabetes. I no longer am taking any medication for high blood pressure as either. And I'm on the path to being metabolically flexible. And I'm not where I need to be, but I'm on my way there. And so tonight we are going to talk about how does this happen? How did I get there? How did we get there? And I'm going to also attach it or tie it into dentistry. I've been a dentist for 30 years, almost over 30 years, actually. Now I can say that.
And a pretty dang good dentist. She's worked in my mouth and had to fix some things.
Thank you. But yeah, I'm going to tie it into periodontal disease, gum disease. And how does that all, how is this all connected? Because we often forget about, right here, the mouth is the window to the metabolic health.
So. Right. And tonight, I'm always excited because we get to bring on guests. One of the things I like, this is kind of a new format that we're doing that we've been working with. And tonight, we really kind of unroll it out with a good friend of ours that has been on lives with us many times and has got an incredible story. And I want to say this, if you are a fan of baseball, then you are in for a treat tonight because we have Derek Henderson, who is I want to say, I don't know if we say it's former or retired. What do we say? Professional athlete, professional baseball player that is with us tonight. And we've asked Derek to come on and share his story about his journey with metabolic health, the uniqueness of being a professional athlete. And I'm kind of curious because, Derek, I know you've got to have seen the pictures of Shaquille O'Neal here recently dancing around. And I know you've been watching Vladimir Guerrero and his journey. I'll be fascinated if you get to add a little bit of that into this as we get to hear your story. I'm going to give you a little bit more of the screen over here. Nobody wants to see my face up there. There we go.
Yeah, thanks, Ken. Thanks, Dr. G, for having me on. I miss doing these because I love talking about metabolic health and both of you sharing your stories. But yeah, so my story is ex-professional athlete, retired 2004. Didn't realize that I was insulin resistant until 2024. And everybody thinks athletes are the most, the epitome of health, which is not true. And I'm the prime example of that. I suffer from low testosterone. I suffer from weight gain and high cholesterol, specifically high triglycerides. And it took me 20 years post retirement to realize why I was in the gym and I wasn't losing weight. And so ran into a good friend of mine, Dr. Eric Aiken, and he told me about insulin resistance. And that's what Dr. G is going to talk about tonight, which is all cool, and how you can address it naturally. And the cool thing is that being an ex-athlete, Ken, is that we've been on a ton of supplements, and a lot of people go out to GNCs and grocery stores and things of that nature. I will be the first one to tell you I've been on a million supplements. What Dr. G and Dr. and Ken going to talk about tonight is a supplement that addresses everything in one, and that's insulin resistance. So that's where I'm at. That's my story. I'm a lifer on the Feel Great system, and again, thank you for having me back on.
Well, it's good to have you back on, my friend. So tell us a little bit, though. Your story is unique because when we think about, you're talking about, all of the supplements, and I see all these advertisements about supplements, and people are getting on this supplement, that supplement, and everything. But then, and of course, as an athlete, you guys have got to probably get hit with all kinds of samples and try this. But then we think you guys must eat really good.
I'm laughing. Let me. Okay, so see, that's a great point, Ken, and I have to laugh because I look back on it and I go, "Oh my God, what was I doing to myself?" So, professional baseball. Let's just take basketball out of it, football, golf, all that. It's the only sport you play every single day. So you're constantly busy, kind of like people are nowadays. They work too much and they don't get a chance to meal prep. They don't get a chance to work out. Baseball, 162 games a year. So you're constantly in hotels, you're constantly on the bus, you're constantly on airplanes, and we eat fast food all the time, day and night. All right, constantly eating. The only difference is that you're playing every day, so you don't sit around and you're not lethargic. But I'll just tell you this: this was my typical diet: fruit juices, which is pure sugar, fried foods, which I just said, fast foods. That's all. We're not going to eat a steak every night. We just want to go play the game, go eat, go to the club, and go to sleep. That's what we did. I'm just telling you. And then my kryptonite was ice cream, cookies, and cake. Terrible, terrible diet.
Oh my gosh.
So yeah, that was it. So that in a nutshell, that's what I did. And again, that's why I suffer from high cholesterol, low testosterone, and belly fat once I retired.
Wow. Derek, thank you so much for sharing that. Now, as people are coming in, this is really important. I know we're going to be sharing stuff, and I've put in the comment, if you're finding this something that you need to share with somebody, because Dr. G is about to unpack some great information that's going to really blow your mind. Every time I listen to her talk about it, I feel like I'm learning something. But type the @ symbol and the person's name. Share it with them. If you are over on, this is streaming right now on Facebook and YouTube. If you're on YouTube, just grab the link. It is @HealthyTogetherAK, youtube.com @HealthyTogetherAK, and share it that way if that works for you as well. So do that, and that'll be how we'll get people in here. Thank y'all. So it's good to see some comments, folks, that are coming in. And make sure that y'all are sharing. This is a great opportunity to get some other people to hear this great information, especially some things that you may not ever heard of before. So I'm going to take Derek off, and I'm going to drop off as well right after Derek does. Dr. G is going to give us some incredible information right here. I'm going to pull that presentation up, and she's going to tell me what I need to be doing to help her during that.
So no different than any other day.
I wasn't going to say anything. I wasn't going to say a thing about it. But Dr. G, this is her area. She's been doing this for years. And y'all just get ready for a treat right here. This is going to be some good stuff. Take notes.
All right. Well, thank you, Ken. Thank you. And thank you for that testimony, Derek. That was awesome. So what are we talking about here? Well, first, let's talk about this. 93% of us are metabolically unhealthy. And what does that look like? It's hard to, envision that. Basically, if you're on your commute to work today and you passed 10 cars or 10 cars passed you, 9 of them are metabolically unhealthy. They're metabolically sick. And what else does that look like? Basically, we're talking about a root cause. And go ahead and the next slide, Ken. What that looks like is metabolic syndrome. And this is making us sick. Okay. We are all sick, and we're going to go diving deeper into how we get that way, because it doesn't end up as some of the things we had mentioned before, like type 2 diabetes and high blood pressure and things like that. But if you have 3 or more of the following, if you have low HDL cholesterol, and what that looks like is lower than 40 in men and lower than 50 in women, if you have a high fasting blood sugar, greater than 100, okay, if you have a large waist circumference, basically if the measurement of your waist is larger than half your height, okay, and that translates to greater than 40 inches in men, greater than 35 inches in women, then you have a symptom of metabolic syndrome. The other things that you want to look out for is high triglycerides, greater than 150, or high blood pressure, 130/85, higher than that. Now, if you have to be medicated to stay in range on any of these things, that doesn't count, okay? This is without medication. If you have 3 or more of these symptoms, then you are more than likely metabolically sick or on your way to being metabolically sick. All right, next slide. So we talked about, I was going to tell you, we're going to talk about the root cause. What is the root cause? The root cause of all of these things is insulin resistance. Okay. Now we know what insulin is. It's a hormone. Okay. And a lot of people think that when we say insulin, we're talking about diabetes. Well, that's part of it. Okay. But insulin resistance is something that is at the root cause of many, many chronic illnesses. But it doesn't start off that way. It starts off very subtle, maybe 10, 15, 20 years prior to when you get diagnosed with that type 2 diabetes or high blood pressure or PCOS or arthritis or even periodontal disease. Alrighty. It'll start off, it may look like blurred vision, or you're always hungry. You're always thirsty. You can never get full. You're constantly eating. Dark patches of your skin, skin tags, things like that, eczema, psoriasis, things that you think are allergy related, okay? And it could very well be, but more often than not, it's due to insulin resistance. High blood sugar is one of them. Neuropathy, tingling in your hands and your feet, just starts very subtly. Chronic pain and inflammation, and you're always fatigued, always tired. There's nothing you can do that you just can't seem to not be tired, okay? So it all starts about 10 to 15 years prior to that, but then leads into all these things. We call this the plagues of prosperity. And all of these things we also can call it an insulin resistant squid, okay? Because over time, this develops into those. All right, next. So what is insulin resistance, okay? In your normal body, when insulin is working the way that we want it to work. And by the way, insulin, there's nothing wrong with your insulin, okay? It's just your body is reacting to it. So normally when we have insulin in our body, insulin is the response to us eating carbohydrates, okay? When we eat carbohydrates, we elicit a glucose spike, and then insulin rises to match that. What happens is their insulin acts like the key, okay, to open up the cell to get the glucose in the cell for energy, alrighty? And when it's working perfectly fine, that's exactly what happens, okay? Takes it out of the bloodstream, gets the glucose into the cell, and all is well with the world. Everything acts like normal. But when you are insulin resistant, what happens is you begin to eat, then you elicit a glucose spike. Your insulin rises to meet that spike. It wants to bring down that blood glucose. And for some reason, that key, that insulin, cannot open the receptor of the cell because the cell is full. It's already full of glucose. Okay, so it can't hold any more glucose. But insulin has a job to do, okay? It has to find a place to put that glucose. And the first place it's going to do that is in your bloodstream. And then it's going to start looking for other places, and it's going to start storing it as fat, okay? Next slide. So let's talk about this. So here's the top 10 leading causes of death. Now, I know it's 2020. We're going to need to update that slide, Coach Ken. It's now 2026, so we should be able to get an updated slide. But just for, it's probably hasn't changed much. I will tell you that. Leading the way here is heart disease, okay? And despite a medication called a statin, that is the number one medication that's prescribed in the United States for heart disease. It's for cholesterol, but it's to help prevent heart disease. Heart disease is still the number one cause of death. Now, in yellow, you'll see the heart disease, Alzheimer's disease, and diabetes. We're going to focus on those. Last week, as we build on this lecture and this series, last week we focused on diabetes, and this week we're going to focus on not only diabetes, but heart disease as well, and then we'll lead into Alzheimer's another time. But I wanted to show you this. The importance here is the number one cause of death is heart disease, but we also medicate with that. So let's look at the next slide, and we'll dive into it a little deeper. One of the things I saw in my practice is that around 2013 to, well, it was about 2015, I saw a lot of patients coming in that were on a statin medication that weren't on a statin medication before. What concerned me most, though, was that it was a younger population that I was seeing that were coming in more and more with statin medications being prescribed. So if you look at the date on here, it's December 3rd, 2013. The guidelines for prescribing a statin medication changed. And what that new guideline stated that adults 40 to 75 years of age with a cholesterol from 70 to 189 without any risk or without any pre-risk of diabetes or cardiovascular disease, they were to be put on statin medications. Now, you may think, oh, well, that's not so bad. I mean, that's preventive, right? Well, maybe. Go ahead and advance to the next slide. Let's talk about this. So this is what I call the pharma loop. It is basically how we go from being placed on one medication to being put on many medications, okay? And how do we get there? All righty. It's another word or another name for this is called polypharmacy. So do note that this is one example that I did see, and this can happen with any medication that you're taking. It can happen over a year. It can happen over multiple years' time. It can happen over many months. And I'm going to start with a statin medication because that Lipitor is a statin medication and is the most prescribed medication in the United States. We're going to start with that, okay? And I'm going to go through this pharma loop. And at any point, you know, if you are taking any one of these medications or know someone taking a medication, this can happen because medications have many, many side effects, all righty? So let's start with you have high cholesterol, you go to your doctor, and they put you on a statin medication. Over time, you then develop, for some reason, you're pre-diabetic. They prescribe you metformin, which metformin is another one of those medications that is very much prescribed for pre-diabetes, okay, in the United States. Then all of a sudden, you develop high blood pressure, or you've had that, they just were monitoring it, and then they decide to give you some medication for that, maybe one or two medications. Over time, you develop a neuropathy. They give you another medication, gabapentin. And then over time, further, you start developing acid reflux or leaky gut or GERD. They put you on a proton pump inhibitor, esomeprazole or omeprazole. And then throughout the next several months, you go into a state of depression or anxiety. They give you more medication for that. You develop some type of arrhythmia with your heart. They give you that type of medication. Actually, it's a beta blocker. They give you, it's for high blood pressure, but they give you that to help control that arrhythmia that you developed. And then the next time you go in for an appointment, you are then diagnosed as a type 2 diabetic. So what is going on behind the scenes? Why all of a sudden did you go from having one medication to multiple medications? And a lot of times the answer is, well, you're just getting older, or it's just your history, it's family history. It's nothing you could do about it. Our metabolism slows down as we get older. And I'm here to tell you that here's what's going on behind the scenes, okay? That statin medication that they prescribe for you, they fail to tell you that there is a side effect that it can cause type 2 diabetes, which led to the pre-diabetes diagnosis, okay? Then when they put you on metformin, they failed to tell you that it decreases B12 absorption. And why that is important is because if we don't have B12 or we reduce that absorption and that's interfered with, neuropathy can develop, tingliness in your hands and your feet, okay? And then as time goes by, what happens is your gut microbiome is, you develop kind of like a dysbiosis. It's a dysbiosis where you start to develop leaky gut or an acid reflux, and they put you on omeprazole, okay? And then what happens is you start gaining weight, you go into a state of anxiety and depression, because what happens is your gut microbiome is off, your dopamine and serotonin, which are produced neurotransmitters in your gut, they're not working right. So that's why you start to develop anxiety and depression. Well, that med leads to other things going on. Your cardiac arrhythmia, what they failed to tell you is, going back to that statin medication, it decreases the production of CoQ10. And what that leads to is muscle soreness, fatigue, and cardiac arrhythmias, okay? And then over time, the other thing that a statin medication and a proton pump inhibitor have as a side effect is type 2 diabetes. So there's a double whammy there, leading to all these other issues going on. And then you become a type 2 diabetic. You're diagnosed with that. And they want to put you on Ozempic and Mounjaro. And one of the things I just found out today or yesterday is that one of the other side effects of statins, they have many, it's many, you can look them up. But one of the ones that I was not aware of is that it decreases the production of your hormone GLP-1. Okay, and we're going to go into that a little bit more tonight. Ken's going to go further into that. So is Derek, okay, about what GLP-1 does for your body. All righty. Next slide. So now you're probably saying, okay, that's great, that's wonderful, but how does this tie in to periodontal disease and dentistry and diabetes and heart disease and all those things and Alzheimer's disease? Well, it was found that those patients that were diagnosed with diabetes, heart disease, and Alzheimer's disease, there was a link to the same bacteria that caused the periodontal disease was present in all of those other chronic diseases, diabetes, heart disease, and Alzheimer's disease. All right. Next slide. So what does this look like? So it begins with what we're eating. We're going to go into nutrition a little later in this webinar, but let's talk about what we're eating. Remember, I said the mouth is the window to your metabolic health. So when you are eating food, you're eating your proteins, your fats, and your carbohydrates. Your proteins and your fats are metabolized in your small intestine, your stomach. Okay, so we're just going to talk about carbohydrates for right now. So when we eat carbohydrates, they are broken down into simple sugars by an enzyme in our mouth called salivary amylase. It's in our saliva. And it's broken down into simple sugars. The bacteria in our mouth love those simple sugars, and they produce a biofilm. That biofilm is that white, sticky stuff, plaque or tartar. Well, plaque that leads to tartar, but the plaque is the initial thing that happens, and it sticks onto your teeth and gums. If you rub your tongue on your teeth right now, you probably have some plaque on your teeth, okay? Now, that dental plaque, if it is not brushed away in a timely manner, or if it's not effectively brushed away, over time it sits on your gums and it sits on your teeth, all right? And it causes inflammation. Well, your body looks at this inflammation as a sign of trauma, and it wants to lessen that trauma. So it sends out some it elevates your cytokines and your white blood cells, to attack the area of trauma. But we keep eating and we keep consuming these processed foods and we keep eating carbohydrates. And over time, we get more and more dental plaque, more and more tartar or calculus as that plaque hardens, and it causes inflammation of your gums. And then what happens is the bacteria and the pro-inflammatory cytokines, they get their signals crossed and they disrupt the insulin pathways because of this inflammation. It's causing all these problems. This leads to increased blood sugar. When we have increased blood sugar, we are then more likely to develop diabetes. Diabetes is basically 98 million Americans have prediabetes, and 38 million have diabetes, and most of them don't even realize it. Now you say, well, I don't know. I mean, I've never had any problems with that. And my gums, they're okay. Well, I just say not yet. If you haven't been diagnosed with one or the other, it's more than likely going to happen. 64 million Americans have some form of gum disease. Okay. That's about 48% of Americans. And if you have gum disease, you're going to be likely to develop diabetes because of what I just explained here. You have increased blood sugar. And then when you have diabetes, you're more likely to develop periodontal disease, because with diabetes, you are immunocompromised and you are more likely to develop develop infections. And periodontal disease is caused by a bacterial infection. So it is a bidirectional relationship. Now, I also said we were going to talk about high blood pressure and how that can also be a bidirectional relationship with periodontal disease. Go ahead. You can leave this slide up because basically it starts out the same way. You're going to start by eating, and those carbohydrates are going to lead the way into increasing your blood sugar. But let's first talk about what a normal, you can go ahead and go back for a moment, what a normal blood pressure looks like. So basically with insulin helps your blood vessels relax by making a chemical called nitric oxide. Okay. And when this is working properly and everything's going well and you don't have insulin resistance, this helps with vasodilation. All right. So the muscles then are able to relax and contract normally, and allows oxygen and nutrients to the organs that need it. Now, when you have insulin resistance, the nitric oxide producing pathways become impaired. So vasodilation cannot occur. Okay. And this causes the vessels to not be able to relax like they normally would. And the signal gets weaker. So the blood vessels then stay tighter. And since the signaling pathways, they're all out of whack, they're not registering properly, the blood vessels stay tighter and the muscles of the vessel walls, they tend to grow. The smooth muscle can grow. And this causes even further constriction. This is where we get vasoconstriction. The narrower and the stiffer the vessels are, it makes it harder for blood to flow, and thus the pressure inside goes up. Insulin also tells the kidneys then to store more salt and water, so you have an increase of the amount of fluid in your bloodstream. When you have more fluid and you in the same space, this means an increase of blood pressure. And Ken had already shown that picture, and it's just like that. Go ahead and do the next slide. Basically, it's like having a garden hose that is closed off at one end and the faucet is still running. Okay. Now, how is there a bidirectional link? How does periodontal disease and high blood pressure, and how is insulin resistance, how is this all related? So with gum disease, it causes that inflammation that we were talking about, and the periodontal bacteria enter the bloodstream along with those pro-inflammatory cytokines, and that leads to disrupting that insulin signaling pathways, and this raises blood pressure. So when your blood pressure is high, it worsens your gum disease, okay, because it can reduce the blood flow to your periodontium, which is the teeth and the tissues of your mouth. And this makes your gums more vulnerable to infection, okay? And that's how this is a bidirectional relationship. Now, next slide there, Ken. we're going to talk about nutrition, and I'm going to hand this over to Coach Ken because he's going to dive into the nutrition aspect of how what we can control is when what we're putting into our mouth. Okay, because we have the ability to control that, and how food does impact our overall health.
Right. Thanks, Dr. G.
You're
So
welcome.
here's something I want to talk about. So as we talked about what Dr. G was saying with the food and everything that we're eating, and of course what's happening in our mouth makes all the difference in the world. What we don't realize is back in 1963 was the year that J.R. Reynolds Tobacco Company is going to come along and buy a food company, Hawaiian Punch. Well, here's the thing that's going to really change dramatically our entire food system, because what are tobacco companies really good at? Making things that are really addictive. So they turn their scientists and really focus on those aspects of our food. How do we make it more hyper palatable so we want to eat it? All those things in bags and boxes and bottles full of processed food and barcodes. Now, something really exciting for some people happened this week. I feel as a nutrition coach, very impactful for our health overall. And even if you weren't paying attention, this is a great way for you to learn just a little bit something different. Is we just had a big change when it came to how we look at food. For years, we've been looking at the food pyramid, right? And regardless of how many times I've heard people say, we don't pay attention to the food pyramid, I want you to think and ask this question. When you go to the steakhouse or the Italian restaurant, what do they bring you for free? Every single meal. Type in the comment, how many things, what foods do they bring you for free when you go to the Mexican restaurant? What do they bring you for free there? They bring you things that are carbohydrates. We focus on that. And that, as Dr. G was talking about, the salivary amylase begin to break carbohydrates down into glucose in the mouth. The old food pyramid put a priority on eating simple carbohydrates, breads, rice, pastas, all right, corn, potatoes, all right, those things, those French fries, all those things we love to eat, all right. The new food pyramid have flipped everything upside down. And as we learn and we've seen is that when we focus on eating in a particular order, fiber, proteins, right, Mary? We get the bread. Exactly. It's the bread is what we get for free. And they keep bringing it. I mean, how many places bring you stuff for free? Let's think about it. There's reasons for that. That stimulates the body to crave more food. When we start with fiber and protein when we're eating, we feel full longer. We trigger and help our bodies to produce GLP-1. Now, we want to help that along because GLP-1 is a catabolic hormone that stimulates in the brain that hunger signals that says, hey, you know what? I'm full. I don't need to eat anymore. So changing this pyramid, we want to say we put the carbs at the end of the meal. Now, the other part about this, though, is how the old way has impacted our food is our modern food environment and how we approach food. The dilemma is we keep eating all day, right? We get up in the morning, and what do we start with? We were told that what meal is the most important meal of the day? Breakfast, right? Breakfast is the most important meal of the day, but we start with carbohydrates. And when we start with carbohydrates, we are spiking our blood sugar. And that insulin hormone is trying to bring it back down. When we eat all day long, we eat. And I'm just curious. I'll throw it out there. Think about it. What were you taught? How many times a day were you taught to eat? 3, 6 meals a day? Did you know that the average U.S. American actually eats between 6 and 11 meals a day? That's a lot of food. That's a lot of food. And when we look at it, the fiber has been removed. That was what the tobacco companies learned, was that when we took fiber out of the food, it made the food more shelf stable, something that would stay longer. All right. It would make us hungrier. It would disrupt our insulin pathways. It would disrupt our GLP-1. We wouldn't feel full, even if we happen to be. It's not signaling correctly. So our food has been stripped of the fiber. Now, how does that play out when it comes to how we are eating? What are we going to do? Well, if you'll remember what Dr. G said, 93% of Americans are metabolically unhealthy. 95% of us do not get enough fiber in our diets. We are not eating correctly. And so we've got to change how that's happening. But what are we going to do? One of those things is changing the order that we eat. All right, eating in a certain order, make sure we get fiber. That's helping to stimulate the GLP-1 in our bodies through the course of the day. It's helping to control the blood glucose levels that we have through the course of the day. It's actually pretty amazing science when it comes right down to it that we slow down just by changing the order that we eat. We change the outcome of our health. Now, getting there, though, in our modern food environment can be a bit of a challenge. So how can we bridge the gap? Well, one of the big things we can do is changing our lifestyle, changing how we approach our dietary things, but also looking at nutraceuticals. I'm going to bring my friend here back on. And Derek, we're going to talk a little bit about this together. We've done this before, and I'm glad that you're here because as we do this, I think we both bring a lot of great experience, both as coaches, and we work with people on this, that in this, there is a solution to this problem. And it's a simple one, right? It is as simple as it gets. And when we look at this, I want you to look at the very bottom of this chart where it looks at intermittent fasting, a 2-meal method of eating, and prioritizing fiber when we eat. Now, how much fiber did you eat on those trips, Derek, when you were traveling around doing all of the ball games and doing all that? Was salad a big part of what you used to do?
Zero, Ken. I'm telling you, fruit juices and fried foods, which are full of seed oils and omega-6 fatty acids, which I didn't know. That there's no fiber in that food, and it's not real food, as you mentioned earlier. So I'm glad you brought that point out. So no, as a baseball player, nor post retirement, I didn't eat right, and that's why I love the Feel Great system.
Yeah. And so let's do a little bit of experiment. We talk about fiber, when we talk about what it does in our body. Here's the thing. When we eat fiber, those carbohydrates break down into a gel. So this is the first part of the protocol is a fiber matrix. Now, unlike a lot of different fibers out there, I'm gonna bring this up a little bit bigger so people can see it. So I just put the fiber right in here. And what's going to happen real quick, I'm just going to shake this up and we're going to let it sit. All right. Derek knows what's going to happen here. We're just going to let this set for a little bit. We're going to come back to it as we talk about this, but we're making sure that we get our fiber. And what we've learned is in this protocol that it is something. I'm actually going to advance the slide because we're going to get to see a little bit more about this when we advance forward just a hair. All right. Where'd it go? What happens with the fiber? Well, the fiber in particular has been studied both at the University of Sydney, which is home of the glycemic index, and you can sit there and see in the chart how it lowers that postprandial glucose spike. At the Cleveland Clinic, arguably the #1 heart hospital in the world, they studied this and they made the determination that it acts like a lipid-lowering drug. So your cholesterol, your triglycerides, your issues with, Dr. G talked about that, with our blood pressure. Those are all things that fiber plays a role in when it comes to our health, in helping to feed our good gut microbiome, irritable bowel syndrome, constipation, diarrhea, skin, anxiety, and depression. Every single one of these plays a role in there, and changing the profile of our food is really what we're at. Now, this didn't set for very long, I know, but you guys are going to see, I'm going to pull this back up a little bit. As we look in here, you can see this is coated the inside of here. Folks, when you look at this bottle, it is completely coated. This is like very much a gel. And so this is what's happening to our food, and it's changing the profile of our food and improving our overall health. Now, the second part of this is something that I know that if there's somebody that talks about this probably better than anybody I know is Derek, and that is Unicity's Unimate. And Derek, I want you to talk a little bit about this because as an athlete, and I know you work out, you're in the gym, this is a game changer. And I know for a lot of people I've been talking to lately, the issues of food cravings and intermittent fasting, and that's where really Unimate's really kicks things off. So would you talk a little bit about that for us?
Sure. The Unimate is an amazing tea that it's funny because one of my most viral videos was on Unimate. And Unimate is an extract that's cultivated in South America, so it's a very natural tea. They actually call it the miracle tea down there. And everybody knows, as you can see on the screen there, everybody knows the rave of GLP-1 shots, and I'll go ahead and name them because they are our competition: Wegovy, Mounjaro, and Ozempic. Just so you know, GLP-1 stands for glucagon-like peptide. I think Dr. G mentioned that earlier. You produce that naturally. Well, the Unimate, which is the extract of the yerba mate plant, is it raises it by 67% more, and you don't need an injection to do it. You just got to wake it up. And that's the cool thing about this. And Ken, Dr. G will tell you that we all sip on this for about an hour at least. I take 2, sometimes 3 a day. Actually, I'm on my 3rd one today because I started going back to the gym. And that when that GLP-1 is raised, it's going to get rid of food noise. And Ken mentioned it earlier. People eating 6 meals a day, you'll never allow your insulin levels to come down. Well, this Unimate is a great tool to help you do that. And and it tastes great. That's the cool thing about it. The other thing that I like about it is that as an athlete, ketosis was a big thing for us, right? And this raises the body's ketone production naturally, as an athlete.
Right now, while you're talking, Derek, I want people to see how simple this is.
Yeah.
I have water. This is as simple as it gets.
And he's just gonna, just like he did the fiber.
But I'm not gonna let this sit. But this is what we're gonna sip on. This is what we're gonna sip on.
Yep.
Now I'm drinking lemon. Right here. My favorite, honestly, is the new flavor, but we won't get into comparing flavors. But
yeah.
Go ahead.
Yeah, that's what he's sipping on. You can sip on it at night. It actually helps people to sleep, even though it has a little bit of caffeine in it. But the thing is that when you lower, and Dr. G can talk more about cortisol levels, your cortisol levels are pretty high at night. And this does not affect your cortisol levels to the degree to where it spikes them. And you can sleep on it good, even though there's a little bit of caffeine. We do have another decaffeinated thing of Unimate that just came out just a little bit ago. But the bottom line is, and I'll leave it at that, the Unimate is a great tool to keep you from snacking. Because if you think about it, think about potato chips, think about M&Ms, think about popcorn. How many of you out there eat just one? You're constantly eating. And Ken and Dr. G mentioned it earlier. The food industry is in the business of selling us food. So they have to make the food to where it's addictive and that we continually eat. It's not your fault. It's the food. So think about that. And that's the whole thing about it. And, they're in the business of selling food. They're not in the business of reversing yours, and my insulin resistance. That's just the business, and it's nothing wrong with it. But guess what? You've got Dr. G, you've got Ken, you've got myself to teach you that there's a way out of the jungle. So that Unimate is an amazing product. You can't go wrong drinking that Unimate.
No, definitely not. And I think you mentioned in there, we're talking about increasing in your body's GLP-1. I'm going to bring Dr. G back on here. And for those of y'all that are like really focused on that, I know I've had a lot of conversations that that GLP-1 is, like you said, it's made in our bodies. I think we've all hit on that. And
Yes.
this is going to help stimulate your body's natural GLP-1. I want to talk just a little bit. That's not the screen I wanted. I wanted this screen. It's always fun. There we go. All 3 of us on here at one time. So here's the thing. So a couple of things. When it comes to the protocol, starting with the Unimate, we're talking about a protocol that is, we recommend doing it for 90 days. When you are, whether it's intermittent fasting, whether you're dealing with type 2 diabetes, whatever your goals are, if it's weight loss, give this 90 days. When you order the product, it costs about $5.40 a day to order the product. and it's less than a Starbucks coffee. And the average U.S. American spends between $20 and $30 on breakfast, along with all of the snacks in bags and boxes and bottles with barcodes. So when we take that, and if we just go on the low end, let's just say $20. And this blew me away. Let's just do simple math. $20 times 30 days, that's $600 a month. That's a lot of money. I mean, that's a car payment right there. So we're going to take from the money we save, we're going to put that to this. That's going to be the tea. We drink 2 of them. Maybe you want to drink 1 of them and do 2 fibers, however you want to do it. You can do it different ways. But give it 90 days. There's a 90-day money-back guarantee with this. Like I said, you've seen the convenience that this really comes with. You can use your FSA and HSA. We're still in the period of the time of the year. If you have FSA and HSA funds, this is a time to use them. Don't lose them. Use them. This is a perfect time to do that and to think about that. This is vegan. It is kosher. It's halal. So it fits into any diet. However, and we don't coach particularly about dieting. That's not a big focus that we talk about. We're there to help people. But when it really comes down to it, it's really about learning to eat correctly, eating in that food order, starting with that fiber, fats, and proteins and moving forward. So we've got time now. I wanted to give an opportunity. Each one of us works with clients, and those of y'all that are here today, we often get a lot of questions. I know we all have done lives, we've done videos, we've got our clients. And I always like to kind of throw out to those of y'all that are here, if you've got any questions that you would like to throw out, put those in the comment. I'm going to see if I can do that little. I've been playing around with this. So watch this, guys. It's magic.
Nice.
Look at that. Look at that.
So while we are waiting for questions, some other things that I like about Unimate is the chlorogenic acid benefits that helps your body to burn your own fat for fuel. I like theobromine, which helps give that steady release of caffeine. So you're not getting that jolt. It's kind of like a crash and burn effect. And we do have the decaffeinated Unimate out there as well now. And those are some of the other benefits. Another thing that not many people realize, theobromine also helps to increase the enamel and remineralize the enamel and strengthen it on your teeth, similar to fluoride without the side effects. So that's one of those benefits from theobromine.
Right. Definitely. That's great. Thank you for bringing that up and reminding us of that. So just out of curiosity, and I was trying to think of it too, I wanted to remind folks, so if you were invited here by somebody or somebody shared this, if you're watching this at a later time and somebody shared this with you and you're interested in learn more about the product, if somebody invited you, get back with that person. If they shared this with you because they care about you and they want you to be healthy and the best. So if Dr. G or Derek or I shared this with you, then please get with us. But if somebody else did, get with them. If some other coach or somebody that's just a friend that is not a coach, just share it with you because they care. Get with them and talk to them to learn about getting started on the protocol, ordering the tea and the fiber, and are there. So just out of curiosity, I want to throw it up. I don't see any questions yet, but please, y'all put them in the comment section. I need to check Facebook. I'm checking over on YouTube. If you've got questions, put them in there. But what have been some of the questions you two have gotten here recently?
Dr. G, you can.
Okay. One of the things that I always seem to get is these two are very common. Always someone asks me what's in these nutraceuticals, and they're basically plants, vitamins, nutrients, and food. But what I like to think about, and I think about all the time when I get that question, is not once as a prescriber did anyone ever ask me when I prescribed them a medication what was in that medication.
That's crazy.
That's the one. That's one of them. The other thing is when I prescribe that medication, not once did anyone ask me, is that going to interfere with my other medication, or what kind of side effects does it have? I get that question a lot with these nutraceuticals. Wow. And the best part about that is the side effects are basically your body is kinds of weight that it shouldn't be there. It's working more effectively. So one of the side effects, if you want to call it a side effect, I guess we could call it a side effect, is that you're going to lose some weight because your body's going to get rid of what it does not need. All right. And the other thing that I like to remind people is, if you are concerned about what are in these things, they are in the PDR, which is the physician's desk reference. So you can go and look these up. It's pdr.net. Anyone has access to it. You just put in the name and it'll give all the list. In fact, any medication that you're taking, you can put it in there and you can see a lot, and your eyes will be opened as to a lot of what the ingredients are, what the side effects are, what the adverse reactions are, and all those things. It's there.
That's absolutely right.
Derek, what have you had recently?
Ken, I'm going to actually piggyback on what Dr. G said earlier, because I've been on this kick lately because I get a lot of questions, but I kind of want to give a testimony, because what she said about heart disease is so important. And there's a simple test that anybody can do. So if they're watching, if you can see the bottom of my screen, I don't know if y'all can see that, where you divide your triglycerides by your HDL, which actually gives you an idea of how your heart health is going to be in the future. Dr. G mentioned it earlier, and it said, and heart disease is the number one killer in the world. That little test, triglycerides, which is a fat in your blood, and your HDL, which is your good cholesterol. If you do that simple math, that'll tell you that where you are. If you're above 2, you've got problems. 1.5, you're good. If you're below 1, you're good. I'm 57 years old and I'm 1.03, and it isn't because of my diet. It isn't because of my diet. It's because of the Feel Great system. So this is why the Feel Great system is a great thing. I'm so glad Dr. G talked about heart disease, because I've lost 3 friends to massive heart attack. One of them was 5 years younger than me. It was 2 years ago, probably yesterday. So as Dr. G and Ken actually talked about, we are here to help. And these little tools, Feel Great system is simply a tool. If you want to eat perfect, if you want to exercise 7 days a week, I don't even do that, and I'm an ex-athlete. Be my guest, because you can lower insulin resistance that way. But I'm going to cheat a little bit and use this little protocol, because it truly, truly lowers insulin levels, and it will improve your cardiovascular health. And that little test that I showed you just now, triglycerides divided by HDL, actually piggybacks on what Dr. G talked about, is heart disease. That number is above 2, you're at an increased risk, 80%, of having a stroke or a heart attack. So Think about that. Think about that. So I didn't want to answer any talk about that, Ken. I wanted to talk about something that Dr. G talked about. I'm so glad she brought it up, and I just wanted to kind of close that out, because I've been obsessed with that lately.
No, hey, that's totally good. No, I'm glad that you did. So the thing that I find that seems to be coming up often, is something that I think we've kind of heard it, and we've kind of taken it for granted, is the whole subject of hunger cravings, of the food cravings. Coming back to something that I think for all of us, many of us, when we started this, that was a big thing, but people are asking about GLP-1. And I still see, when we go and with the advertising on my television, I can't watch anything without getting a advertisement for GLP-1, of seeing celebrities getting paid. I mean, I'm amazed that people are making millions of dollars and still feel that they need to take money to promote something. We're doing this because we care about people. We are coaches because we're caring about people. We're wanting to share this. We know this works, and we understand the science. And what yerba mate, Unimate, is yerba mate. Let's boil it right down to it. Unimate is yerba mate. It is a tea that is made Brazil, Argentina, Peru. It's in South America. It's grown in a particular area. That yerba mate, the benefits of that have been known for centuries. This is a concentrated version. You don't have to brew anything. You can warm it up if you want. If you want to have it cold and drink it just like I did right here, we're good to go. but it will stimulate, particularly in a fasted state, your body's own GLP-1. The great part about both of these, neither of them will break a fast. If you are fasting, if you are practicing intermittent fasting, neither of these, the balance or the Unimate, will break your fast. And I've had a lot of comments. That seems to be a big thing that a lot of folks may be watching. You are doing some type of intermittent fasting. You're approaching fasting in some aspect of it. These don't break a fast. And the benefits are well documented all the way around. So I know we are coming kind of the end of the time. I don't see any other comments, and I'm trying to get all of our names back up here. I got so fancy that now I can't seem to get all of our is gone. Let's see. There we go. There it is. We're gonna hide it. We'll get our names back up there. So those of all that are coming in, I'm Coach Ken, and I want to thank everybody for being here tonight. Dr. G, thank you for the science, and Derek, thank you for being a guest with us tonight and sharing your story. Do y'all have maybe a word of wisdom that you would like to kind of, as a parting shot as we go from here, that you'd like to share with people?
Sure. So what I want to do is I want to encourage and empower you. The next time you go to your dentist or you see your dentist or hygienist, ask them. Even after they take your blood pressure, they should be doing that. And even if it's normal, ask them if they see any signs of metabolic syndrome, because there's often signs that dentists see. I've diagnosed patients with diabetes and hypertension long before their doctor ever knew, long before they even knew. And when they came back in after they went and had their physical, they came back in and they said, Dr. G, how did you know? And I told them I could see it in their gums. So the next time you go to see your dentist for a checkup or your hygienist to get a cleaning, ask them, do you see any signs of metabolic syndrome?
Awesome. Awesome. Derek?
No, that's awesome. I really never realized it. That, I look at Dr. G as a special one, because medical doctors don't even recognize metabolic syndrome, because they were taught in medical school to manage disease, not nutrition, right? Yep. So that's awesome that Dr. G says that. But my point of the matter is that, look, insulin resistance is real. As long as you eat and drink food, as Dr. G and Coach Ken talked about, your insulin is going to rise. Your job is to keep it low. Your doctor's job is to manage disease. Your job is to prevent it. How you do it is your choice. Just do it.
Well said. Well
Very
said.
well said. Well, you guys got really the deep stuff. I'm going to throw a quote in. Here's one of my favorite ones from Dolly Parton. If you are tired of the road that you're on, then it's time to pave a new path. Ooh. And everything about this is exactly that. If you are tired of the road that you're on, if you're tired of the dental issues, if you're tired of the diabetes, if you're tired of the way the food is making you feel, let's pave another path. And everything in here tonight is what's going to help you. And so if you resonated with anything of us here, reach out to us. We will definitely contact you. We'd love to help in any way we can. Again, Derek, thank you. Dr. G, thank you for being here. And we will be back again in the future. Thank y'all so much for being a part of tonight's live. And we will see you guys back around on the flip side. Y'all have a great one.